Hello all. Let's start with GT 179. I'll be explaining the PSM questions only. So let's start with the first question. The question is question number 78. Identify the illness leading to the following presentation. Okay, so the options are tetanus, pertussis, measles, and trachoma. We can clearly see the hemorrhage, subconjunctival hemorrhage, which is there in the right eye of the child, and which is usually in the cases of bouts after the bouts of cough in pertussis. So the answer is pertussis. So that is the we don't find such hemorrhages in tetanus or trachoma or measles. We don't find such hemorrhages or the redness. We find redness in measles, but these are the hemorrhages which occur after the bout. So the answer is pertussis. Question number 79. If annual growth rate of a population is 1.5 to 2%, okay, and what number of years will it be required to double the population? So actually this is a very good question. We should these kind of questions you can easily solve by doing let's go to the writing section. There is a trick we can say, these kind of answers we can do, but by just dividing 70 by the growth rate. So what is growth rate here? 70 divided by 1.5 to 2%. 2%, either 1.5 or 2%. So 70 divided by 2 is 35, and 70 divided by 1.5 is 47. So the answer is 47 to 35 years. So the answer is 47 to 35 years. This is one very simple question, very simple trick to do such types of questions. Also, in your explanations book, it has been given that there are ranges. So this is done by, these things can be calculated by dividing 70 by your growth rate, and dividing that you will get the time to double the population. Okay, so that is very easy way to do this. So let's go to the question number 79, which is 80s. Strain used in mumps vaccine. Okay, mumps vaccine. The strain used is Gerillin. Edmunds Zagreb is used in where? Measles. It's used in measles. Edmunds Zagreb. Danish 1331, we all know where it is used. Danish 1331 is used in BCG. And the next option is Oka. Okay, Oka is basically, let's just do not confuse. Oka is used in not in measles, not in mumps. It is the strain in varicella. So there is one detailed table in your explanations. I'll just quickly write some of the diseases and strains. So measles, mumps, measles, mumps, varicella, BCG, rubella. So measles, in case of measles it is EZ, Edmundston Zagreb. In mumps it is Gerillin. In rubella it is RA273. In BCG it is Danish 1331. In varicella it is Oka. In yellow fever it is 17D. Hence the vaccine is also known as 17D vaccine. 17D vaccine. Also there are diseases like malaria. You know, malaria vaccine is also there. So malaria strain used is PF25 and SPF 66. typhoid, typhoral basically is type 21A, type 21A. HPV, in two vaccines, there are two vaccines, Cervarix, as I have explained in my earlier videos, Cervarix and Gardasil. So Cervarix, these are basically the brands. Cervarix and Gardasil are the brands, and they use, Cervarix uses 4 strains, Gardasil uses 2. So it has 16 and 18 HPV strains protective against and uses, and it has 6, 11 in addition to 16 and 18. So obviously Cervarix is better, we can say, uses the 4 strains. So these are the strains. Again you can see a quick revision: measles, mumps, varicella, BCG, rubella, YF, yellow fever, malaria, typhoidal, HPV. These are the important ones. So let's go to the next question, which is, if the nation is to be built, the health program should be developed on a foundation of preventive health work, and that such activities should proceed side by side with those concerned with the treatment of patients. This was observed by, okay, this was observed by Bohr committee. Sir Joseph Bohr, he was the leader. In 1943, he was appointed, the government of India appointed Sir Joseph Bohr as the chairman to survey the health needs, the primary health needs of the country, and to plan the activities to achieve the maximum health. So what his committee observed, his committee gave a report in 1943. The committee was formed, submitted report in 46, Bohr committee. And they observed the above statement, which is, if the nation is to be built, the health program should be developed on a foundation of preventive health work, and that such activities should proceed side by side with those concerned with the treatment of the patients. That means they focused upon the treatment as well as the prevention part. So that was their suggestion, the Bohr committee, they suggested this. And let's go to the other options. The other options are Mukherjee, Srivastava and Kartar Singh. Okay, so Mukherjee committee, what was it? Mukherjee. Let's just write Kartar Singh and Srivastava. So Mukherjee committee was, they submitted their report in 1965, Kartar Singh in 73, and Srivastava in 75. What Mukherjee committee said, they said the replacement of A&M should be done by female multipurpose worker. A&Ms should be replaced by female multipurpose workers. Before that, male multipurpose workers were there. And others, all others like health workers, social workers and vaccinators, all should be renamed as male multipurpose workers. So all others should be renamed as male multipurpose workers. So that was their recommendation. Kartar Singh committee in 1973, they recommended the I'm very sorry, we were talking about Kartar Singh committee. They replaced the A&Ms and all others male staff as male multipurpose workers in 73. And Mukherjee committee, they said that separate staff should be there for family planning activities and malaria surveillance, because before there what was happening, the same staff were doing all the activities for family planning activities and malaria and vaccinations and all. So they found out that those staff were under tremendous pressure and they were not easily, they were having difficulties performing their task as multipurpose workers, as vaccinators, as the family planning activists. So they recommended that there should be different posts for family planning activists and for malaria surveillance officers, and the rural and urban family planning centers should be attached to the PHCs. That was the Mukherjee committee recommendation. So PHC with family planning activities, this was their recommendation, and separate workers. Srivastava committee, what they did in 1975, they said that the paraprofessional health workers should be chosen from the community, from within the community, like rural health scheme community, health workers scheme. These were recommended by the Srivastava committee, and they said that the paraprofessional, like paraprofessional health workers like ASHAs and the health workers, activists, those should be chosen from within the community because they know the community well and they know they are the better communicators with the community. So that was the Srivastava community's recommendation. So within community staff, this was the Srivastava community recommendation. So quickly we can know the Bhor, the Kartar Singh, the Mukherjee and the Srivastava committee and their recommendations. We just went through all those things. So the next question is very straightforward. This is the logo of what? So this is the logo of NLEP. The right answer is NLEP, National Leprosy Eradication Program. So NLEP emblem, this symbolizes beauty and purity. So we can see there is a lotus. It symbolizes the beauty and purity. The leprosy can be cured. It says, it has an idea that the leprosy can be cured and a leprosy patient can be a useful member of the society. And in the form of partially affected thumb, it is like this. So partially affected thumb, it says that he can be a member of the society. And a normal forefinger and the shape of house, it makes a shape of a house. So shape of a house, that means the symbol of hope and optimism. That is hope and optimism in a rising sun under the house. So the purity, which is reflected by the lotus, the hope rising with reflects by the rising sun, and the affected thumb and the normal forefinger, which shows that the person can be an active member of the community, of the society. Let's go to the next question, which is question number 83. It says the demography family members refers to. So in case of family size refers to. So in case of normal day-to-day language, what do we mean by family size? Is the number of individuals in a family which constitutes a family, that is the family size. But in case of demography, it is the not the total number of persons in a family, the total number of children a woman has born at a point in time. Yes, this is the answer. So in case of demography, the total number of children a woman has born at a point in time is the family size that is referred in demography. The total number of children born by the woman during her childbearing age, which is generally between 15 to 45 years of age, is the completed family size, So the C option is completed family size. The total number of daughters a newborn girl will bear during her lifetime, assuming fixed age-specific fertility and mortality rate, that is NRR, net reproductive rate. Yes, this is something which should not confuse us. The net reproductive rate depends upon the female population of the society. That means the total number of daughters born to a woman, if during her lifetime, assuming the fixed age-specific fertility and mortality rate, that will reflect the net reproductive rate, because that will depend on the female part of the society, the female individuals of the society. So obviously that will be the daughters born to a particular woman. So that is NRR, net reproductive rate. And the total number of children born by a woman during her childbearing age, which is generally between 15 to 45 years of age, is the completed family size. That means the whole number of children born to a woman during her reproductive age, that is 15 to 45 years, is the completed family size. And the family size, normal family size, is the total number of children a woman has born at a point in a time, is the family size. That is the difference in demography. So these two we should not confirm. So the answer is B, obviously. We should not confuse with these answers. Let's go to the question number 84. According to the growth chart recommended by Government of India, mild malnutrition is defined as child's weight between the, okay. So let's write something. So in growth chart, if you follow the growth chart recommended by WHO, the WHO growth chart, the first degree or grade 1 or mild, mild malnutrition is defined as the child's weight between the 80% and 70% lines. Suppose this is the normal, then 80% and 70% is the grade 1 malnutrition. Grade 1 malnutrition. And the second grade or grade 2 malnutrition is defined as the child's weight between the 70% and the 60% is grade 2 malnutrition. Okay. Below 60% to 50% is grade 3, and below 50% is grade 4 or severe malnutrition. Severe malnutrition. Grade 4 or severe is below 50. So I hope this is clear. 80% to 70% is mild malnutrition. 70% to 60% is grade 2 or moderate malnutrition. 60% is grade 3 malnutrition, and fourth is severe malnutrition. This is the WHO growth chart. Growth chart by WHO. So let's go to the next question, which is question number 85. Which of the following measures the deprivations in basic dimensions of human development? The deprivation in basic dimensions of human development. So physical quality of life index, human development index, human poverty index, and gender related development index. All others except human poverty index are the something good, which reflects the something good in the life of the people, like physical quality of life index, the human development index, and the gender related development index. But human poverty index reflects the deprivation in the basic dimensions of life. So HPI, the human poverty index is human poverty index is HPI equals to 1/4 of P1 plus P2 plus P3 plus P4 a whole power of 1 by alpha. P1 is what? P1 is probability at birth of not surviving to age 60. P2 is adults lacking functional let's just adjust this functional literacy skills population below poverty line long-term unemployment. Okay, so these four parameters P1, P2, P3, P4 are parameters which reflect the poverty factors affecting the poverty line, and this poverty index can be calculated by the average of these summation of these four parameters divided by 4 and then having a power of 1 by alpha. Alpha is generally taken as 3. So probability at birth of not surviving to age of 60, that is something which is not good. It should be, the survival should obviously be more than 60 years for a good country, for a developed or developing country. The adults lacking functional literacy skill, the population below poverty line, and the long-term unemployment. So it is taking into account the health, that means the not surviving till age of 60. It includes the literacy, it includes the poverty, and it includes the unemployment. So for all, combining all these four things, we can calculate the HPI, Human Poverty Index. So this is the answer. Let's go to the question number 8, which is question number 86. The state government's share of expenditure on medical care is of total cost of medical care, and ESI corporators' share of expenditure is cost of total medical care. This is some fact-based question. So the answer to this question is D, that is 1/8 and 7/8 respectively. So we can say that the state government's share of expenditure of medical care is 1/8. The total one part of the eighth part, the state government's share is, and the ESI corporation's share, the share of expenditure is 7th to 8th. 7 means this simply means 7 parts are shared by the ESI corporators and corporations, and the one part is being shared by the state government. So that is one fact-based question, you should by heart it. Then comes question number 87. What's the area under curve between the marked points? So what are the marked points? Okay, let's just zoom this. Okay, we cannot zoom this, so we will draw this again here in the writing section. So this is a normal distribution curve which follows the Gaussian distribution, and the standard deviations shown here are 1, 2, and 3. 1, 2, and 3. So these are the marked points. This is the mean. So the standard deviation 1, standard deviation 2, standard deviation 3. Each sides there we have 3 standard deviations. So between the marked points, this is the minus, this is the plus side. So this is a fact that mean plus minus 3 SDs cover how much? 99.7% of the standard deviation. It covers a 99.7% of the standard deviation. So mean plus minus 3, and so that was given in the question, mu plus 2 standard deviations, which was mu plus 3 standard deviations. It was 99.7%. It covers almost all the data. So 3 standard deviations. If the data are distributed and follows the normal distribution curve or the Gaussian distribution, it mostly around all the data, 99.7%, are covered by the mean plus minus 3 standard deviations. That's a fact, that's the rule. So that is the answer. Let's go to the next question, which is question number 88, which is blanket treatment is useful for control of. Okay. So let's go to the writing section. Let's just see the options: hydatid disease, leishmaniasis, trachoma, or tetanus. Actually, the blanket treatment is for trachoma, and this is why this is known as a blanket treatment, because this is a mass treatment. Mass treatment is being used for trachoma, and the treatment may be given to the entire community. The entire community receives the treatment in the form of a mass treatment, and that is known as the blanket treatment. So that is why this is known as, again, nothing much to do in this question. This is again fact based. This mass treatment is known as blanket treatment, is done in trachoma. So the response, the next question, which is question number 89, the response which is graded by an observer on an agree or disagree continuum is based on. Okay, so there are several scales. So let's write. The answer is Likert scale. There are several scales. Likert scale, visual analog scale, visual analog scale, Gutmann's Let's talk about Likert's scale. Likert's scale is basically one ordinal scale. These are what? These scales are some scales used to depict the distribution of the data in the order, the quality, or the type of data we use. Like most of you might be knowing the visual analog scale, which is used by the anesthesia people. This is one simple scale having 10 divisions, and each division is there for a face, smiling face, and like that, having pain. This is used for pain assessment. Okay, so this visual analog scale, basically what it does, it gives us the characteristic measures for the range across a continuum, across a continuum of values that cannot be easily measured. Like what? Pain. Pain cannot be measured. So visual analog scale gives us the idea about the pain, the person making faces because of pain, and we are plotting those faces in a scale, that is visual analog scale. And what is different in Likert's scale? Likert's scale is analog. It is ordinal. This is not an analog. This is ordinal. This gives usually a bipolar scale. Bipolar means the examples can be agree, disagree, strongly disagree, strongly agreed. So these are the Likert's scale. These types of scales can be said as Likert's scale. These are also qualitative, but ordinal. So some order are there in Likert's scale, and in visual analog scale, this is something which cannot be measured. So that is why these kind of scales are made. Another one is Gutmann's scale. This is also known as cumulative scale. Cumulative scale. This is a unipolar scale, and this is ranked in order of difficulty from least extreme to most extreme positions, least extreme to most extreme. Like these are statements. These can be statements like the persons are agreeing or not. So they are agreeing, not agreeing, strongly disagreeing, like that. But these are unipolar, not the bipolar like the Likert scale. Agree or not agree. These are agreeing, strongly agreeing, mildly agreeing, moderately agreeing, strongly agreeing. So this is the Gutmann's scale. This is cumulative and is unipolar. And what is Likert? Likert is bipolar. So that is the difference between Likert's scale and Gutmann's scale. And visual analog, I already told you. So the question was graded by an observer on a agree or disagree. That means bipolar, and that is Likert's scale. So the answer is Likert's scale. Next is question number 90. The oral dose of retinol palmitate for children more than 12 months of age as per vitamin A prophylaxis schedule is. Okay, again the question is fact based. Question number 90. So the answer is D, that is 2 lakh international units every 4 to 6 months. That's the answer. So let's just see how it is. The dose time, less than 12 months, 1 lakh every, say, 4 to 6 months. More than 12 months, 2 lakhs, again every 4 to 6 months. Newborn, 50,000 international units at birth. Childbearing age, 3 lakh international units within 1 month of giving birth to the mother. And pregnant and lactating, 5,000 IU every day or 20,000 IU per week. So this is the table you should remember. Mostly the questions come like for children less than 12 years, less than 12 months, and children for more than 12 months. So the answer is 1 lakh and 2 lakhs international units every 6 months. This is the prophylaxis. And sometimes it is being asked for the pregnant and lactating women. For the pregnant and lactating women, it is 5,000 international units per day or 20,000 international units per week. So that is the requirement dosage you should remember. Mostly you should remember the children one and the newborn and childbearing age and pregnant lactating women. Usually these questions are not being asked, but to remember is good. So we were discussing question number 91, true about a negatively skewed data. The answer is mode is more than median. So you should remember, we have discussed so many times about the skewness of data. You should remember then skewed to the left skewness, the order is mode, median, mean. This is the order. For right skewness, the order is same but in reverse. Mean is more than median, which is more than mode. So these are the orders. And what is left skewness? Left skewness is negative and right skewness is positive. We have already discussed in the previous videos about the skewness and how it is left and right skewed and why it is negative or positively skewed. But most of the people, they get they get confused about the order, which is more than which and which is less than which. So you should remember mode is more than median is more than mean. So this is the order: mo, me, m, mo, me, m. So mom, m. This is the mnemonic you can say: mom, m. And it is in the left skewness and just opposite in the right skewness. In this way, you will be able to solve the questions like this. So let's go to the next question, which is question number 92, which is not true but true about net reproduction rate, NRR. Okay, so answer is it gives approximate magnitude of completed family size. Completed family size, it does not give. Total fertility rate gives the approximate magnitude about the completed family size. NRR gives only female births are included in NRR, as we previously discussed in previous questions. Mortality is taken into consideration, yes. Target 1 will be achieved by CPR is more than 60. Yes, this is a fact. You should know that when a couple protection rate becomes more than 60%, NRR of 1 can be achieved. NRR of 1 can be achieved if it becomes more than 60%. So a CPR of more than 60% can result in NRR of 1. Or we can say to achieve NRR of 1, the CPR should be at least 60%, more than 60%. That is a fact. So again, the next option, which was only female births included, yes, NRR we know it is the amount of female child born to a lady that gives a reflection of the female population, and mortality is taken into consideration because mortality and current fertility rates are included, and target 1 will be achieved by CPR of more than 60. So it does not give approximate magnitude of complete family size, but the approximate magnitude of complete family size is given by the total fertility rate. So that is the answer. Answer is D. Next question is question number 93. In triage system for disaster management, which of the following color code denotes dead or moribund patient? This is very simple. The color code black we know is for dead and moribund patient, and that is of the minimum priority because we know that nothing can be done for the dead or near dead patients. So the priority is for not those black coded patients, but high priority is being given to the red color coded patients where urgent treatment or transfer is required so that the life can be saved. So that is the principle behind these color coding triage systems. And there is yellow for medium priority and green for ambulatory patients. So just quickly we can write black for dead or moribund, red for urgent treatment, priority 1, green for ambulatory, patients, and yellow for medium priority. So this is triage. This is triage, and we have discussed in our earlier videos about triage in details. So this is a very simple question. So let's go to question number 94, which is EPI has recommended that DPT vaccine can be safely and effectively administered as early as how many weeks after birth? So 6 weeks. Although now DPT is being replaced by pentavalent vaccine, but the schedule remains same, 6 weeks, and after 6 weeks after birth. So what is the schedule for DPT nowadays? The DPT is being replaced by pentavalent, which includes DPT plus hepatitis B and H influenza B. So pentavalent, the schedule is similar to OPV and 6, 10, 14. 6, 10, 14 weeks. So at 6 weeks, at 10 weeks, and at 14 weeks, these are being given. So the recommendation is to give the DPT not before 6 weeks, as EPI recommends. Let's go to the next question, which is, in satisfactory drinking water, the presumptive coliform count per 100 ml should be. Okay, so it should be 1 to 3. The presumptive coliform count per 100 ml should be 1 to 3, not more than 1 to 3. This is basically, let's write it over here. The class of the drinking water can be class 1 or very good, which is excellent, excellent. Class 2, which is satisfactory. Class 3, suspicious. Class 4, unsatisfactory. So there are two things which are there for the quality of water. So presumptive coliform count per 100 ml and E. coli per 100 ml. For excellent, it should be 0. For satisfactory, it should be 1 to 3. For suspicious, it should be 4 to 10. And if it is more than 10, then it is unsatisfactory. And for E. coli excellent, it should be 0. For satisfactory, it should be 0. For suspicious also, it should be 0. And for unsatisfactory, it should be 1.1 or more. So this is the table you should remember about the classification of drinking water, whether it is excellent quality or this depends on the presumptive coliform counts and the E. coli itself. So let's go to the next question, which is question number 96. Which of the following is true about hookworm? Ground itch is associated with hookworm. Known to cause rectal prolapse and myocarditis. Eggs do not float in saturated solution of common salt, and ivermectin is the drug of choice. So question number 96, what is the correct answer? Hookworm, yes, ground itch is associated with hookworm. Ground itch. Hookworm is what? Ankylostoma, what we call Ankylostoma duodenale, the hookworm. It's the portal of entry. The worm enters via skin. The portal of entry is the skin. The adult worm lives in the small intestine of the humans, and humans are the only definitive host. So the eggs, coming to the eggs, if we consider the eggs are, these float in the saturated salt solution, and these are habitual blood suckers. Habitual blood suckers, the Ankylostoma duodenale, that is why they are cause of anemia also. These are habitual blood suckers. It causes bronchitis and bronchopneumonia, creeping eruptions, cutaneous larva migrans, what we call, underneath the skin, we all know. The ground itch, Ankylostoma dermatitis, which is known as ankylostome dermatitis, which is the ground itch, and the iron deficiency and dimorphic anemia, as I already told you. So, and the treatment is ivermectin, and it is the drug of choice for the treatment of cutaneous larva migrans and scabies also. Also, this is the drug of choice for this hookworm. Let's go to the question number 97, which is regarding HPV. True is. HPV types 1, 2, 3, 4 cause Verruca vulgaris. So 1, 2, 3, 4, yes, they do cause Verruca vulgaris, which is what? The common warts. HPV type 6 and 11 are associated with condyloma acuminata. Condyloma acuminata 6 and 11. These 6, 11 and 16 and 18 strains are covered by Gardasil Cervarix vaccine, which is quadrivalent. So 6, 11 are associated with condyloma acuminata and intraepithelial neoplasia. And also 16, 18 can, as we all know, can cause cervical cancer. So there are, all the above are correct. So question number 97, the answer is all the above are correct. Let's quickly go to the question number 98, which is a enterically transmitted single-stranded RNA virus that is most important cause of large epidemics of acute hepatitis in Indian subcontinent. Okay, so HAV, HDV, HEV and HGV. So what happens here? HAV, hepatitis A virus, is RNA. It is single-stranded, positively coiled. HBV, we all know, is only DNA containing and is double-stranded. HCV is RNA and single-stranded and positively coiled. HDV is RNA, single-stranded and negatively coiled, and HEV is RNA, single-stranded and positively coiled. So only negatively coiled is HDV, single-stranded RNA. And so what does the question ask? Which is the enterically transmitted single-stranded RNA virus? Enterically transmitted. Which are the enterically transmitted? So you should remember the mnemonic: vowel, vowel. So all the vowels like A and E are transmitted by vowels. That means enterical. Enterically transmitted are, all the others are blood transmitted. So vowel, vowel are enterically transmitted. So A and E and A are enterically transmitted, and that is the most important cause of large epidemics of acute hepatitis in the Indian subcontinent and elsewhere. In the Indian subcontinent. So HEV is because the large epidemics are caused by the HAV, acute hepatitis, in the Indian subcontinent. So the answer is HEV. Next is question number 99, which is identify the component of NSCP as shown in the image. Okay, so the image shows, let's just go to the question section. So the image shows the family and protecting a child and the emblem of AIDS, which is a crossed red ribbon. So it shows the PPTCT, which is Prevention of Parent to Child Transmission Program. It was started in 2002 and it has witnessed a significant, a large change in and the scale up of HIV prevention, and the HIV counseling and testing centers have been formed, and PPTCT HIV screening is also undertaken as a part of the treatment course in the sub-centers, in the medical colleges, the super specialty tertiary centers, and ART and PPTCT is along with ART, and the ICTC, integrated counseling and testing centers, are also formed, and these are under the these are along with the PPTC ART, where the distribution is being done, and the counseling centers are there where the patients get counseling about their treatment and what to do and what not to do, and regarding the general knowledge, attitude and practices about HIV. So the emblem signifies PPTCT, prevention of parent to child transmission, because there are a mother and father and a child in that emblem. So this indicates PPT-CT. Let's go to the question number 100, which is identify the lesion shown. Yes, identify the lesion shown in the image. The answer is herpes zoster. This is a typical of herpes lesion, which is one-sided towards the face and is very painful. And the typical rashes are like painful, and these are medium to moderate to large size rashes, and these affect the typical area over the around the around the eyes and upper face, and that is why the answer should be herpes zoster. Measles are not this large, and chickenpox is not always like in one half of the face. It's obviously overall the face. Rubella is also overall. So this typical presentation in the one half of the face is of herpes zoster. Question number 101. The softening of water is recommended when the hardness exceeds. Okay. The softening of water is recommended when the hardness exceeds how much? 150 milligram per liter. So 150 milligram per liter is what? Or we can say 3 milliequivalents per liter. That is a permissible. If it increases beyond more than 3 milligrams per liter, more than 3 milliequivalents per liter, or more than 150 milligram per liter, it is softening is recommended. It's not acceptable. Softening is recommended. Okay. So again, 1 milliequivalent is how much? 50 milligram of calcium carbonate per liter of water. This is the hardness of water. So 150 milligram of calcium carbonate per liter of water is the hardness of water, and that is the 150. If it increases beyond 150, so that means that becomes difficult, and the hardness level becomes very high, and then softening is recommended. So let's go to the next question, which is, so this converts this, ends the test, all the PSM questions in the test, and I think you all are clear about the test. So thank you.